Good day everyone, this is your student nurse Anabelle Bautista from BSN 1B, and today I will be showing you on how to properly assess or to perform a return demonstration about physical assessment, which are the skin, hair, nails, eye structure and acuity, and lastly the mouth and oropharynx. And when we say physical assessment, it is the process of evaluating objective anatomic findings through the use of observation, palpation, percussion, and auscultation. But before we proceed onto that video, let me show you first the equipment needed. So without further ado, let's begin. The materials needed are gloves, pen light or flashlight, magnifying glass, centimeter ruler, alcohol, tongue wooden depressor, gauze pad, Snellen chart or Jaeger test for the distant visual acuity and near visual acuity, and lastly the opaque card. So the assessment that we are about to begin is the skin. As we all know, our skin is the largest organ and first line of defense of our body against the invasion of microorganisms. Second is the hair. Hair is the mass of thin thread-like structure on the head of the person or any of these structures that grow out of the skin of a person. Third is the nails, and it is like a plate-like keratinous translucent structure that consists of highly specialized epithelial cells. Next is the eye structure and the acuity. Eyes are organs of the visual system, and the acuity is the sharpness or keenness of eyes to distinguish shapes and details of objects at a given distance. And lastly is the mouth and oropharynx. And as we all know, our mouth is the beginning of the digestive system and a substantial part of the respiratory tract, and oropharynx is the part of the throat at the back of the mouth behind the oral cavity. Prior to the procedure, we need to introduce self and verify the client's identity using agency protocol. Then we need to explain to the client what we are going to do, why it is necessary, and how he or she can cooperate. And then we need to discuss how the results will be used in planning further care treatment. So good afternoon, ma'am. I am Anabelle Bautista, your student nurse from ISU Ilagan Campus. So for verification po, may I ask your name?
I'm Jasmine Balagunan.
Okay po, then your birthday,
June 4, 2003.
your age po.
18.
Okay. So for today, ma'am, I'll be assessing your skin, hair, nails, eye, and your visual acuity, and also your mouth and oropharynx. Nandito po ako para magbigay ng insight sa inyong current health status, and it is necessary para malaman po namin kung ano ang i-advise at may bibigay po namin necessary care for you po. So for me to be able to assess those parts, may I ask for your consent kung pwede ko pong hawakan yung mga yun? And I need you also to stay calm and cooperate. So before I start po, I need first to perform hand hygiene. And I will observe appropriate infection control procedure, and also to provide for your privacy, ma'am. So, I am done for hand hygiene. I need to ask some question more regarding sa inyong health history, so that we'll be able to give you the necessary care. So ma'am, are you experiencing pain or pangangati and skin problems like lesions, bruises, abrasions, like pigmented spot po?
Yung pangangati lang po, right and left, and it's quite disturbing po.
And may family history po ba kayo ng any skin problems? Meron po ba kayong mga ginagamit na medications like kagaya ng lotions and home remedies po?
Meron po para matanggalan po yung pangangati po.
And may excessively dry or moist ka bang nararamdaman sa skin mo?
Wala.
Madali ka bang magkapasa?
Hindi po.
And may mga problema ka ba na nararamdaman ba year sa mga mati sa skin mo? Sa medication mo ba, meron ka namang nararamdamang problema doon?
Wala po.
Recent contact with allergies, yung mga may allergy na person?
Wala.
Okay. So, ma'am, I need to inspect your skin color and also the uniformity of your skin. Okay, can you do this po, ma'am? Okay, thank you po. Okay, ma'am. So I observed that your skin color is light brown and also nakita ko po na meron kayong konting lesion sa inyong forearm. Since there is no edema, I will no longer assess or describe the location, color, temperature, and so on. So now I will be going to inspect, palpate, and describe the lesions. But before that, I need to wear my gloves po. So wait for a second. I will wear my gloves because the lesions are open and draining. Okay, to palpate texture lesions and to determine the shape and structure, I need to use my index, middle, and ring finger. Okay, ma'am, I will now hold your forearm. I will observe and palpate skin moisture, and I will use my dorsal side of my hand, which is the back. Also, palpate skin temperature. We need to compare the 2 feet and the 2 hands using the back of our hands. So ayun po, ma'am, I observed that your skin is warm po and hindi masyadong mainit. So it's indicate na wala naman po kayong sakit or sinat and hindi din po dry yung skin nyo or oily. Moist lang po siya and it's good to know. So assess skin turgor, fullness or elasticity by lifting and pinching the skin on an extremity. Pinch ko lang po ng konti yung skin nyo and sa baba po ng paa para ma-assess kung may edema. So, ma'am, there is no presence of edema po. Nung hinawakan ko yung legs nyo and feet nyo kasi bumaling naman po siya agad and hindi siya nagbuo ng hole. And nung sa skin naman po, for turgor test po, meron naman po siyang mobility and bumalik agad. So, I have observed also that your skin is quite thick, so it's good po. So, ayan, okay ma'am, tapos na po tayo sa skin. So, the second part of our assessment na gagawin ko is to inspect your hair, ma'am. So, okay lang po ba na hawakan ko ang buhok mo, ma'am? Okay po. But bago po yun, I need to ask some question po. And, ano po yung recent na ginagamit nyong pang-color or pang-kulot ng buhok nyo?
Wala po.
Pang-straight?
Wala po.
Na-try niyo na po bang magpa-chemo before kung may sakit po kayo or what?
Hindi po.
Okay po. So, thanks for responding po. So, now I will inspect your hair na po. I will inspect the evenness of growth over the scalp, inspect hair thickness and thinness, and also I inspect hair texture and oiliness. and note for the presence of infection or infestations by parting the hair in several areas, checking behind the ears and along the hairline at the neck. So, i-inspect ko po yung body hair mo, ma'am. Then po, as I observe, medyo may kanipisan na po ang buhok nyo. But wala naman po akong nakitang any scars or lesions and infections. And also wala din po akong nakitang any oiliness and dryness pagdating po sa scalp. And also wala naman pong hair loss na pwede pong mag-lead sa alopecia po. Next po na gagawin natin, ma'am, is I will assess your nails po. Pwede ko po bang hawakan yung nails mo, ma'am? Yes. But before that po, ask ko lang po kayo kung may history po ba kayo ng diabetes, mellitus, peripheral circulatory disease po, or may previous injury po, or any severe illness po? Wala. So, okay po. I will now touch and assess your nails po, ma'am. So at this point, I will inspect the fingernail blade shape to determine its curvature and angle. So I also inspect the fingernail and toenail texture of the nails. Ini-inspect ko po yung fingernail and toenail structure po. So, ma'am, I will inspect fingernail and toenail bed color. And also inspect tissues surrounding nails. So, ma'am, I will perform blanch test of capillary refill. Press 2 or more nails between your thumb and index finger. Look for blanching and return of pink color to nail bed. So, ma'am, i-press ko lang po ng konti ang mga daliri mo and yung nails mo. So, mag-document lang po ako na. Okay po. I-document ko lang po ng iba na. Okay po, I observe that your nail is quiet, groomed, and clean. Pink tones din po ang color ng nails and nakadikit naman po and walang nakaangat and any loosen of the tissue sa nails mo, ma'am. And pagkatapos ko po na pinch for capillary refill and branchness po, bumalik naman po agad yung pagka-pinch, which is a good sign po siya, ma'am. The assessment that I will be going to do today is to assess the eye structure and acuity. Okay, ma'am, I am going to assess your eyes and also your visual acuity po. But before, I will ask you some question. Kung may history po ba kayo ng hypertension?
Wala.
How about blood dyscrasia po?
Wala.
Or eye disease injury?
Wala po.
Surgery po?
Wala din po.
Last visit niyo po sa ophthalmologist?
5 months ago po.
Okay, ma'am. How about current use of medication pa?
Eye mo lang po.
Okay. Gumagamit po ba kayo ng contact lenses or glasses po?
Glasses lang po.
And ano po yung hygiene or practices for collective lenses niyo po? Kung paano niyo po linisin yung eyeglass niyo?
May binigay po sa akin na panlinis po din sa glasses ko.
Okay, ma'am. Current symptoms of the eye problems na nararamdaman niyo po?
Kapag malayo po yung isang bagay o tao po, hindi ko na po.
Okay po, ma'am. So, okay, thanks for responding, ma'am. But before I assess your eyes po, I need first to perform hand hygiene. And also, I need to provide privacy. Okay, I will lock this. Ang first part po na inspect natin is the external eye structure. So, I need to inspect the eyebrows for hair distribution and alignment and also skin quality and movement. Okay, ma'am. So, please raise your eyebrows po. And then lower po. Okay, thank you, ma'am. And i-inspect ko din po yung eyelashes nyo for evenness or distribution and direction of curve. Titignan ko lang po yung eyelashes nyo, ma'am. Okay, thank you po. Okay po, ma'am. As I observe, your eyelashes are equally distributed and symmetrical. And also, your eyeballs are globe, firm, and there is no tender. I can see no swelling of the eyeballs also, ma'am. So, okay, let me wear my gloves pa so that I can proceed to some procedure. Then, I will inspect the eyelid surface characteristics, skin quality and texture, position in relation to the cornea, ability to blink, and frequency of blinking. Okay, ma'am, titignan ko po ang inyong eyelids using this pen light. Okay, thank you, ma'am. And then, may I ask po to blink your eyes 3 times. 1, 2, 3. Tataas ko po ang inyong eyebrows. Then, close your eyes now. Okay, thank you. Close your eyes now. Okay, thank you po. Next is to inspect the bulbar conjunctiva that's lying over the sclera for color, texture, and the presence of lesions. Look up po. Then look down, side, and side. Inspect the palpebral conjunctiva that's lining the eyelids by averting the lids. Okay po, ma'am. Tumingin ka po sa taas. And then, I will avert your lower lids po. Okay, thank you, ma'am. So, ma'am, I see problem in your eyes po. So, I need to avert your upper eyelids. Okay, ma'am. Can you please look down po and keep the eyes slightly open. And I will use this applicator stick po to avert your upper eyelids. Okay, ma'am, to return your averted eyelids, can you please look up and then blink? Okay, thank you, ma'am. Next is, I will inspect and palpate the lacrimal gland. Okay, I will palpate your lacrimal gland by using the tip of my index finger for inspecting kung meron ka pong edema. Okay, I will inspect and palpate the lacrimal sac and nasolacrimal duct. So, ma'am, ipapalpate ko po ang lacrimal sac at nasolacrimal duct mo and hahawakan ko po siya pababa. I will inspect the cornea for clarity and texture, and also I will ask the patient to look straight ahead, and I will hold a pen light at an oblique angle to the eye. Move the light slowly across the corneal surface. Okay, ma'am, tingin lang po kayo straight ahead po. Perform the corneal sensitivity reflex test to determine the function of the fifth or the trigeminal cranial nerve, and I will ask the client to keep both eyes open and look straight ahead. Okay, ma'am, can you please open your eyes and tingin lang po kayo sa akin. Slight touch ko lang po ang cornea nyo using the corner of this gold pad po. Straight ahead lang po yung pagtingin mo. inspect the anterior chamber for transparency and depth. Use the same oblique lighting as used to test the cornea. Okay, ma'am, i-check ko po ang anterior chamber mo for transparency, and I will check also the depth of your eyes. And we need to note if there is any shadow in the iris. Next is to inspect the pupils for color, shape, and symmetry of size. Pupil charts are available in some agencies. Since we don't have any pupil charts, I just need to inspect the color, shape, and symmetry of size of the pupil by using this pen light. Okay, ma'am, please open your eyes. Assess each pupil's direct and consensual reaction to the light to determine the function of the third oculomotor and fourth tracheal cranial nerves. But before that, I will close the lights and tingin lang po ng diretso sa akin, ma'am. Okay. I will also inspect for the consensual po. Assess each pupil reaction to accommodation. Okay, I will hold a pen light po. So, tingin po kayo sa top ng object and sa wall po. Okay. Okay, I can see and observe that your head is not moving po, and I will take note of that. But I didn't see any weakness of the eyes po. Moving on for the visual fields. Okay, the first procedure is to assess peripheral visual fields to determine the function of the retina and neuronal visual pathways to the brain, and second, optic cranial nerves. For me to be able to do that, I need to have the client sit directly facing me at a distance of 60 to 90 centimeter, 2 to 3 feet. Okay, ma'am, cover your right eye po with this opaque card and tingin lang po sa akin directly. Ilan po ito, ma'am? 1, 2. Okay, ma'am, then I will close my eyes directly at your nose po. Ilan ito, ma'am? Okay, thank you, ma'am. Okay po, I will hold again this pen light po. Okay, ma'am, saan niyo po unang nakita yung moving object? Left. 90 degrees. 70 degrees, and I will move it downward and upward. Then, 60 degrees, move it upward and downward. Okay, thank you, ma'am. Straight ako po. Okay, next to assess is the extraocular muscle test. Assess 6 ocular movements to determine eye alignment and coordination. Okay po, ma'am. Tatayo lang po ako dito, straight of view, then don't move your head po. Just follow this pen light by your eyes only. Assess for location of light by shining pen light on pupil in corneals, surface, or Hirschberg test. Okay, ma'am, I will perform Hirschberg test po, and I will use this pen light and light at the center of your nose. Okay, thank you, ma'am. Have a client fixate on a near or far object. I will cover one eye and observe for movement in the uncovered eye. Okay, ma'am. Iko-cover ko lang po ang isang eye mo, ma'am. And fixate on far object po. Next is the visual acuity. Okay, I will assess near vision by providing adequate lighting. Okay po, ma'am. Read this Jaeger test and wear your eyeglasses po. 14 inches away po ang pagbasa niyo. Okay, basahin niyo po ang number 7.
Able to treaty the restitution of the standards and prisoners which had been taken in the defeat of Crassus.
Next is to assess distance vision by asking the client to wear corrective lenses unless they are used for reading only. Okay po, ma'am. Ito-cover ko lang po ang left eye mo, ma'am, then fixate po kayo sa far object. Okay, ma'am, you already wear your glasses po. Okay, upo ka lang, ma'am, then I will cover your left eye, then identify the letters on the chart po.
E, F, T, O, Z, L, E, E, D, P, E, C, F, D, E, D, F, C, Z, E, F, E, L, O, P, Z, E, B, E, F, P, O, T, E, Z, L, E, F, O, E, F, C, T, F, D, F, L, T, C, E, O, F, E, Z, O, L, C, F, T, D.
Okay, i-cover ko naman po yung right eye mo, then read the letters again.
E, F, T, T, O, Z, L, E, E, D, P, E, C, F, D, E, D, F, C, Z, E, F, E, L, O, P, Z, E, B, E, F, P, O, T, E, Z, L, E, P, O, D, F, C, T, F, D, F, L, T, O, C, O,
Okay, ma'am, and read it without the cover of your eyes po.
E, F, P, E, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, E, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, D, R, D, E, F, T, C, E, O.
Okay, ma'am. Sige, ma'am, i-record ko lang po yung readings of each eye niyo po. Since my client is able to see the top line of 20/200 of his Snellen type chart, I will no longer perform functional vision test. Okay, ma'am, thank you so much po for your participation. So the first procedure that I will be going to do is to inquire if the client has any history of the following questions that I will ask. So ma'am, before we start po, ask ko lang po kayo kung may history po ba or routine patterns of dental care.
Meron po.
Okay po. And last visit po sa dentist.
Last month lang.
Ano po ang ginawa niyo, ma'am?
Nagpa-adjust ng braces. Kaka-adjust lang po ng braces.
Okay, ma'am. So, length of time, ulcers, or other lesions po?
Wala po.
Okay. Dentures or discomfort?
Wala din po.
And last po is medication po na nare-receive mo.
Wala.
Okay po. Next is to position the client comfortably seated if possible. So, my client is already in comfortable position. Inspect the outer lips for symmetry of contour, color, and texture. So, okay po, ma'am. Mag-proceed po tayo sa lips and buccal mucosa po. But I will ask po for your permission if pwede ko pong hawakan or i-touch po your lips and mouth. Okay lang po ba, ma'am?
Yes po.
Okay po. Before that po, perform lang po ako ng hand hygiene. Magsusuot lang din po ako ng gloves kasi hahawakan ko po ang inyong lips. So, okay, ma'am, may you do this po? Okay. I observe that you have a uniform pink and soft, moist, and smooth texture po ng lips nyo. And also, symmetry naman po siya. And yung contour is maganda po. And also, you are able to purse your lips po. Next procedure is to inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and the presence of lesions. So, okay, ma'am, you may relax your mouth and I will pull out toward the lips. will inspect also your gums and teeth po. Okay, thank you, ma'am. Next is to inspect the teeth and gums while examining the inner lips and buccal mucosa. So, okay, ma'am, can you please open your mouth po? Ulitin niyo pong i-open yung mouth mo. Okay, relax your lips po, then open your mouth or jaw. Okay, thank you, ma'am. Since my client has no dentures, I will no longer inspect the condition like broken or worn areas. Okay, ma'am. Next to assess is your tongue and floor of your mouth. Inspect the surface of tongue for position, color, and texture. Can you please protrude your tongue po? Ilabas niyo po like ito. Ilabas niyo po, ma'am. Baba. Yan. Okay, thank you po. Next is to inspect the tongue movement. Roll your tongue po upward, then move side to side like this. Okay, ma'am. Thank you. Okay, ma'am. Can you place the tip of your tongue sa roof ng mouth niyo po? And lakihan niyo po yung mouth. Okay, thank you, ma'am, for your cooperation. Next is to palpate tongue and floor of the mouth and any nodules, lump, or excoriated areas. So, I will use gauze pad po to hold your tongue. Can you ilabas niyo po yung ganyan? Okay, next is the salivary glands. I need to inspect salivary duct openings for any swelling or redness. Okay, ma'am, can you open your mouth po? Then place your tongue at the top. Okay, thank you po. Next is the plates and uvula. I need to inspect the hard and soft palate for color, shape, texture, and the presence of bony prominences. Okay, ma'am, can you tilt your head backward po? Open your mouth, ma'am. Then, yun lang po yung dila niyo. Inspect the uvula for position and mobility while examining the palates. Open your mouth, ma'am. And say, ah. I will use my pen like po. Say, ah. Ah. Say, ah. Again. Ah. Okay. I need to inspect the oropharynx for color, texture. Inspect one side at a time to avoid eliciting the gag reflex. So, okay, ma'am. Open your mouth again. And next is to inspect the tonsils behind the faucets for color, discharge, and size. Open your mouth again, ma'am. Next is to elicit the gag reflex by pressing the posterior tongue with the tongue depressor. Okay, after doing all the assessment, I need to document findings in the client record using forms or any checklist supplemented by narratives when appropriate. Okay, that's all about my physical assessment. Again, I am Anabelle Bautista, your nurse student from BSN 1B. Thank you and God bless.